Morning everyone, my name is Mickey Draper. I'm a health and safety consultant for THSP. I appreciate all your time today in joining me on this Toolbox Talk. Today what I want to talk about is mental health in the workplace. It's just as important as physical health and safety, and it affects everybody at some point in their lives, either personally or through someone they work with, manage or support. This talk is about awareness, understanding what support is available and encouraging people to speak up. This aim is simply to ensure that everyone knows that help is available and where to find it. So the legal aspect and a bit on the HSE's perspective on workplace health and safety. So at present, there's no specific law in the UK that require employees to provide particular mental health support services, such as counselling or mental health first aiders. However, this does not mean that mental health can be ignored. Under the Health and Safety at Work Act 1974 and the Management of Health and Safety at Work regs, employees have a legal duty to protect employees from harm, including harm from mental health. The HSE makes it clear that work-related stress is a health and safety issue, not an individual weakness. The HSE's expectations to employees include identifying and assessing risks to mental health, including work-related stress, take reasonable steps to prevent or reduce those risks, consult with employees about mental health and well-being, and then act when they become aware of mental health concerns. The HSE's management standards for work-related stress sets about best practice in areas such as workload, control, support, relationships, role clarity, and managing change. While these standards are guidance rather than law, they present the benchmark inspectors will use when assessing how well an organisation is managing health and safety risk. Mental health itself then. So mental health includes our emotional, psychological and social well-being. It affects how we think, how we feel and how we act, how we handle stress and how we relate to others and how we make decisions. In the UK, stress and anxiety, depression are among the most common causes of work-related ill health and sickness absences. From a legal perspective, employees have a duty under the health and safety legislation to protect both physical and mental health at work. Workplace factors such as workload, long hours, lack of control, poor communication, bullying, harassment, or major change can all impact mental well-being. Equally, personal factors outside the work can affect how someone feels at work. Recognising the signs then. So mental health problems often develop gradually and early signs are not always obvious. Some of the signs in ourselves and colleagues may include changes in mood or behaviour, withdrawal from normal activities, difficulty concentrating or making decisions, increased sickness, absence or lateness, or being unusually irritable, anxious, low or tired. Noticing these signs then does not mean we need to jump to conclusions or trying to diagnose anyone. It simply means being aware and being supportive. One of the biggest barriers in managing mental health is a fear of speaking up. People worry about stigma, they worry about judgment, and they worry about the negative consequences, whether that's through work or personal. It's okay to say you're struggling, and it's okay to ask for help. Speaking up early can prevent issues from becoming more serious. If you are concerned about a colleague, a simple supportive conversation may make a difference. Something as straightforward as I've noticed you don't seem yourself lately. Is everything okay? You do not need to have solutions or answers. Listening and encouraging someone to seek appropriate support is often enough. Some of you may have attended the mental health first aiders course, or you might have heard of the course. So many organisations have trained mental health first aiders. The courses and the first aiders are trained to listen in a non-judgmental and confidential way, to offer reassurance and initial support, and help someone access appropriate professional help. They're not counsellors, nor are they therapists. They do not diagnose conditions. Their role is to support and to signpost. Mental health first aid training typically involves a 2-day accredited course covering how to recognise mental health conditions, support someone in distress, and respond to crisis situations. Refresher training is usually recommended every 3 years. Details of mental health first aiders and how to contact them should be available within your workplace through notice boards, any intranet pages, and through HR communications. Some of you may have heard of the Employee Assistant Programs, also known as EAP. So many employers provide access to Employee Assistant Programs. They're a confidential support service, usually available 24 hours a day, 7 days a week. It's free for employees to use, and in many cases, it also covers immediate family members. Typical support available through the EAP then can include a 24-hour mental health helpline, short-term counselling by phone or video, support with stress, anxiety, low moods and sleep issues, advice on financial, legal and family concerns, and as well as an online wellbeing resources and self-help tools. The service is confidential and no information is shared with your employee. You do not need permission from a manager to use it. There is also free external support services available to people if you're not aware. So Samaritans is a good example of that. So they're available 24 hours a day, 7 days a week, and you can contact them on the number 116 123. They offer confidential emotional support for anyone who is struggling or feeling overwhelmed. The NHS as well, you can ring 111 and they can be contacted for urgent mental health support. And obviously you've got your normal GP practice as well, which remains an important first point of contact for ongoing mental health care and advice. These services are available whether concerns are related to work or personal circumstances yet. Creating a supportive workplace then. So a positive mental health culture relies on everyone playing their part. And this includes treating mental health concerns with respect and taking it seriously. Making support visible and easy to access, encouraging open, non-judgmental conversations, supporting colleagues to seek help early. Looking after mental health is not just a management responsibility, it is something we all contribute to throughout our actions and attitudes. To summarise then, so mental health is a key part of health and safety in the workplace. Although there are no specific mandatory mental health support services required by law, employees do have clear legal duties to manage mental health risks. The HSC expects organisations to take work-related stress seriously and follow its guidance and management standards. Support is available both within the workplace and through external support services. Speaking up early and supporting one another can make a real difference. If anything discussed during today's Toolbox Talk has raised any concerns for you, yourself, or someone you work with, a friend or colleague, please don't ignore it or deal with it alone. Reach out to the support that is available. I appreciate all your time today, and that concludes today's Toolbox Talk. Thank you very much.